A very good evening to one all present over here. Myself, Dr. Sheena. So today we'll be dealing with the topic dental materials, some of the important and recently asked or continuously asked questions, and the related theory portion will also be discussed in this series. Okay. So directly going to the question, the first question is chromium is added to stainless steel as it provides. So there are certain terms that you need to know when we deal with the topic stainless steel. So here the question is like, what is the use of chromium? Why we need to add chromium in stainless steel? So either you can memorize by a mnemonics like CC. Chromium is added for the corrosion resistance mainly. What happens is like you need to know the theory portion. So when we add chromium, normally in stainless steel, there is 12 percentage to 30 percentage of chromium by weight seen, which is added to the carbon steel called as the stainless steel. So what happens is like the chromium get reacted to the oxygen to form Cr2O3, as you can see in the second paragraph, and this is called as passivization. So you should be familiar with the term passivization, where the chromium get reacted with oxygen to form chromium oxide. So what happens is like this chromium oxide form a barrier which actually prevent the diffusion of oxygen into that and other corrosion species which prevent the further corrosion taking place. So like always remember, chromium is added to prevent or for a corrosion resistance. Either you can memorize it as CC, that is the mnemonics, or just think about the chemical reaction that is taking place. Right. Next question. During electroplating, silver is deposited as. So, electroplating is actually also called as electrochemical deposition, which is a process of producing a metal coating a solid substrate. So, whenever we do a electroplating, where does the silver get deposited? Silver always get deposited in the cathode side. So, some of the point that you need to keep in mind is like, whenever we take an impression is always made conductive. On the surface of the impression, we'll be adding some silver. So what happens is like it helps in the adherence of the rubber-based material and it acts as a cathode. So always think this point, silver is actually added on the surface of impression material. Sometimes the question might be like which material is added on the surface of impression to make it is conductive. So it is always silver that is added on the surface of impression material to make that conductive so that this rubber-based impression material can adhere to the particular surface. So what is a solution that, so we know that when there is a cathode and an anode, there should be a solution that is present. So a pure silver anode is required with what solution? It is always silver cyanide plating solution that is being used. So always care must be taken so that acid is not being introduced or added, because acid react with the cyanide solution forming cyanide vapors that can lead to some dead chamber gases, which is very lethal. Right. So it is always important to remember this question. So silver is always added to make the impression material more conductive, which is the solution asked is like silver cyanide is used, but it should not be mixed with any acid. It can produce some deadly gases. So the chemical deposition of silver from silver nitrate solution can be used if greater surface detail production is desired, right? And next point that you need to remember is the current setting during this electrochemical reaction is 5 MA, which is suitable to start the plating of single tooth impression. So please memorize all the important terms which has been asked in this question. Next important question, which is the most commonly used monomer in adhesives? So we are most familiar with all the terms here, BIS GMA, HEMA, Tech DMA, META, etc. So which is the most commonly used monomer in adhesive is always BIS GMA. So BIS GMA, some of the terms or some of the points that you need to keep in mind is generally adhesive resins, we know that it is composed of BIS GMA. Keep in mind, BIS GMA is hydrophobic in nature. And along with BIS GMA, Tech DMA, UDMA, and a small amount of HEMA is also added. HEMA, you need to consider it is hydrophilic in nature. So sometimes the question may be among the following, which is not a hydrophobic material. So you need to differentiate between the hydrophilic and hydrophobic material that are seen in the adhesive resin. So hydrophobic material include BIS GMA, Tech DMA, UDMA. And hydrophilic is like a small amount of HEMA is present. So this is very important point that you need to keep in mind. That is the hydrophilic and hydrophobic material that is actually seen in a resin matrix. Next important question is like, which is the most common monomer that is actually seen in dental composites? It is actually BIS GMA. So BIS GMA is the most common monomer, and Tech DMA is like the most common dilutant monomer that is present. So it is, we know that Tech DMA is often actually used to regulate the viscosity of a particular material. So Tech DMA is actually used as a dilutant in a monomer. Now, what is HEMA? HEMA, the point you need to keep in mind is like HEMA is actually a hydrophilic monomer that is actually seen in the adhesive. So please keep in mind all these points when you deal with the resin matrix that is commonly being used. Next question, the best pickling solution for gypsum bonded investment is. So pickling solution, so before answering this, I would like to explain some of the theory part. So one of the best pickling solution for gypsum bonded investment is like 50% hydrochloric acid solution. So what is the action of this hydrochloric acid? Hydrochloric acid aids in the removal of all the residual investments that is actually seen. And also they help in the removal of the oxide coating that is actually seen on the surface of the investment that is formed. So normally, as I said, it is like think hydrochloric acid that is 50% that is commonly been used. So what is the problem with hydrochloric acid that you need to keep in mind? It actually forms fume from the acid that can actually corrode the metal furnishing. In addition, these fumes are very much having some health hazards, and also it can actually cause corrosion of the material. So the answer for this question, the best pickling solution for gypsum bonded investment is think like 50 per half the hydrochloric acid is being used as a pickling solution. Next important question, the two solid surfaces rest or slide over each other. A very small area have real contact that are known as. So these terms we are not much used in our day-to-day practice or during our theory preparation. So we know that the whenever two solid surface actually slides over or rest over a particular thing, it is called as wearing. So wearing can be of good or bad. Wearing is bad when especially when two tooth contact with each other, and wearing is good especially when we do actually polishing and finishing. So when we do the contact between two surfaces, there are certain area where small area where contact, real contact take place. So this real contact area are called as asperities. Please keep in mind this term. Asperities are actually the very small area that have real contact when two solid substances collide or slide over each other. Next question is 42-year male wants replacement of his missing mandibular second molar and first molar needs fixed bridge. Which category to ISO 1562? So again, before answering this question, you need to know the various gold casting alloy classification according to ISO 1562. So please keep in mind this chart for answering this question. See, The ISO standard 1562 have given a classification for the cast gold alloy and also certain examples where it has been applied. So type 1, type 2, type 3 and type 4 are there. Type 1 is like low strength casting gold alloy, and there you need to mainly concentrate on the application of the casting gold alloy that is being used. The first is being commonly used for inlay. So you can memorize it as 1, that is for inlays. The second one is like the medium strength cast gold alloy, and it is actually used for two things, that is inlay as well as onlays. They are actually used. And third is like hard casting gold alloy. They are used for onlays and also Pontics, full crown saddles, etc. The last is like extra hard type, which is being used for the bridges because that is more stronger and help in actually like concentrating all the occlusal forces. So the crowns, bridges, partial denture frameworks are being actually used by the extra hard casting gold alloy. So in this question, now we can answer. The 42-year male wanted replacement where he needs a fixed bridge. So we need a casting gold which can concentrate large amount of actually strength. So the answer for this question is like type 4 because type 1 is actually used for inlays, type 2 is used for inlays and onlays, type 4 like onlays and all the very thin casting material, and extra hard has been actually used for all the saddles, bridges, etc. So by memorizing this chart, it will help you to actually answer this question and related question accordingly. Next question, what is the maximum depth of penetration of laser in laser welding? So we know that in orthodontic wire welding, etc., we used to use heat to actually join two metal parts. So laser is being commonly used in welding. So we know that like when we use laser, the amount of heat produced is very less. So what is the maximum depth of penetration that you need to study like as such? It is like 2.5 mm is the maximum depth of penetration of laser that is used in laser welding. Another question that was seen like related to this is like for joining titanium component, which laser welding is used? In which gas is used? So laser welding with argon gas atmosphere is the most important choice for joining the titanium component. So please keep in mind this point. Next question. What is the function of chromium in a cobalt to chromium alloy? As I told earlier, please memorize it as CC. Chromium is always used in the corrosion resistance. It is always used for actually the corrosion resistance. So some important point that you need to keep in actually mind is like chromium, as I told earlier, they react with the oxide to form chromium oxide. So they form a very thin layer on the surface of this metal and prevent the further diffusion of oxygen and further deterioration of the metal is being prevented by this very thin chromium oxide layer. So this process is called as passivization method. Very important, passivation method. So what happens is like we know that chromium oxide, it actually form a layer which prevent the further corrosion, and passivation is very important. It is often attained by adding 12% of chromium especially. It can range from 12 to 30%. At least 12% of chromium should be there. So next important question is 18 to 8 stainless steel composition is. What is 18 and what is 8? 18% is chromium and 8% is nickel. So in stainless steel, it mainly consists of chromium and nickel. 18:18 means chromium and nickel, right? And also it consists of 0.15% of carbon. So austenitic, we know that there are various forms based on the heating pattern, etc. So austenitic stainless steel is the form of iron carbide and which actually provide a resistance to corrosion. So you need to memorize which is the material that actually prevent the resistance to corrosion, that is austenite. Next question. Stabilization in stainless steel is obtained by the addition of. So before answering this, you know that chromium is a person who actually give resistance to corrosion because of the production of chromium oxide, and that is called as passivation method. So before answers, like, you know what is passivation. The next thing is when we heat the stainless steel to 400 to 900 degrees Celsius, in the passivation method, chromium reacted with oxygen. Here, chromium combined with carbon to form chromium carbide, and this result in the corrosion resistance of steel is reduced actually in this case, and this is called as actually sensitization procedure. So stainless steel, we know that normally it have actually chromium oxide is there. So what happens is like chromium oxide, which is the prevention method. But when we heat in like 400 to 900 degrees Celsius, what happens is like they combine with the carbon to form chromium carbide. That process is called as sensitization. So we need to minimize the process of sensitization, right? It is not good because the corrosion resistance is being reduced. So what, either we need to actually reduce the carbon content so that the chromium doesn't react with the carbon, one, or the second method is by adding the two T's, titanium or tantalum. So titanium and tantalum is preferred form of carbides that can be added to the stainless steel to prevent the level of chromium, and this is called a stabilization. So in order to actually stabilize, what happens is like we'll be adding titanium, actually tantalum, to the surface of carbon, which actually prevent the further deterioration or the corrosion of the material, right? So these three important terms you have to keep in mind while you deal with the question stainless steel. First is passivization. Second is passivization is chromium oxide, which is a good stage. Sensitization is chromium carbide, which is the least resistant phase, and largest is stabilization phase. Stabilization phase, instead of carbide, we will be adding titanium as well as tantalum. So now you can answer this question. Stabilization in stainless steel is obtained by the addition of, so that is like nickel, chromium, cobalt, titanium. So we know the two T's, tantalum and titanium, are actually used for actually preventing or stabilizing the stainless steel, right? And another important thing that you have to keep in mind is like 18 string, we already know like chromium 18%, 8 is nickel, and iron, it consists of actually 71%. Next question, pH of hemostatic agent used while impression taking. So we know that we used to take actually impression, and hemostatic agents are actually used so that all the finish lines, etc., is being actually captured in that impression, right? So we use various hemostatic agent. So before going into this question, you need to know something about the hemostatic agent. There are two types of actually hemostatic agent commonly being used, class 1 and class 2. Class 1 is like the normal vasoconstrictors, adrenergics, which we used. Class 2 is also called as the hemostatic agent. Hope you understood. Class is the vasoconstrictors, the medications which we use. Class 2 is actually the hemostatic agents, or actually the astringents which we use. So vasoconstrictors like epinephrine, how they do is like they do not coagulate. Instead, they act by constricting the blood vessels. But the other like astringents or hemostatic agents, they actually causes the precipitation of the protein on that area, and that is how they actually causes the coagulation, right? So you have to know pH of actually the astringent is always acidic, which is in the range of 0.7 to 2.0. So the answer for this question, the pH of hemostatic agent while impression taking is always acidic in nature. The next question, which of the following non-aqueous elastomeric impression material shows highest linear contraction? So you can see in that image, see, it is actually the graph showing the linear contraction to that of time. Here, the condensation silicon and also the polysulfide are actually showing larger linear contraction. That is, it has the tendency to shrink faster, because we know that in condensation silicon and also polysulfide reaction, there is byproducts means formed like the alcoholic solution, alcohol, as well as water products. So whenever we deal with the condensation silicon and polysulfide, we should always pour it as soon as possible because they have the capacity to show higher linear contraction, while the polyester and adhesion silicon can be poured a little bit later because the linear contraction is less when compared to that of the condensation silicon and polysulfide material. So the answer for this question is condensation silicon. So it is most common for condensation silicon, followed by the polysulfide and polyether and addition silicon. So next important question, change in hue perception with change in luminescence is known as. So before answering this question, again, you need to know the theory part. So what happens when we see a light? When we see a light, there are three sets of receptors that is seen in our retina called as a cones. So we know that our cones are actually sensitive to red, blue, and green. So what happens is like the signals from our retina, that is a cone, has been sent to actually the brain. So just remember, like think we are in a low light level. So what happens is like instead of cones, the rods in the retina are more dominant when that of actually cones. So the color perception is lost. What happens like when we actually slightly improve the brightness, our like from rods they get converted into the cones and the brightness become more intense as the color appear to change. This is actually called as luminescence on hue effect, also called as Biselt-Brook effect. So the question is like, what happens to the hue perception when there is change in luminescence? Luminescence in this sense means the light that is used. So when light increases, the brightness also increases. This is called as Biselt-Brook effect. So please keep in mind this very important term. Next question is least biocompatible orthodontic virus. So nickel is actually a material which is most commonly seen as allergic material. So what happens is like in the fourth option, NITI, it consists of nickel as well as titanium. So what happens is like the concentration of nickel is more. So it is actually the least biocompatible material, that is NITI. Another important is that the order of corrosion is again, NITI is more when compared to that of austenitic stainless steel, followed by alloy. Next is beta titanium, right? So please keep in mind two important questions from this. NITI is actually the commonly seen material with least like biocompatibility. That is mainly because it consists of nickel that is often allergy. And the order of corrosion is also like NITI, austenitic, followed by eugenol and beta titanium, right? Next is highest slope in stress strain graph is actually seen in, right? It is like highest slope in stress strain graph is seen in which, so stress strain graph actually indicate the modulus of elasticity or Young's modulus, also called as elastic modulus. So we have to think about certain material which is having the elastic modulus. It is like enamel, dentine, composite, and ceramics are there. So when comparing the enamel is having larger modulus of elasticity like 84.1 is actually seen. In the case of dentine, it is 18. Composite, it is like 10. Ceramic, it is 78. So we need to actually memorize certain modulus of elastic materials number. That is because most of the question, number-based question has been actually asked from this. So the question is like, highest slope in stress strain graph. So we know that it is actually enamel. Enamel followed by dentine, enamel followed by the ceramic material, which is near to that of ceramic, then dentine and composite, etc. So please keep in mind the important material with elastic modulus, right? Next question, which of the following is not a processing wax? So before answering this question, you need to know about the classification of waxes and the various types of waxes that is present. So first is like pattern wax, processing wax, and impression waxes are there. So pattern wax contain, you can memorize like CBI. It is like casting wax, base plate wax, inlay wax. So three important things, CBI. Casting wax, base plate wax, and inlay wax. Processing wax is like bus. It is like boxing wax, utility wax, sticky wax. So CBI and a bus, memorize like that. The impression wax is like the normal which we take, the bite registration wax and also the correction wax is been actually seen. So the question answer, which is not a processing wax. We have already studied the processing wax is like bus, BUSC. The first three is having that mnemonics like boxing, sticky and utility. So the answer for this question is like inlay wax. Inlay wax is not a processing wax. It is actually a pattern wax. So you can memorize like CBI, right? Next question. The coefficient of thermal expansion of inlay waxes. So this is actually a clear-cut question, and sometimes the question might be the range of thermal expansion of inlay wax. So you have to memorize like 217 to 512 into 10 raised to minus 6 is actually the range of coefficient of thermal expansion. And the average is like 350 into 10 raised to minus 6 per K. Right. K means actually the degree of raise in actually temperature. Next question is multiple nodules in the inner surface of casting can be avoided by. We know that there are some irregularities or indifferences we see while we do a casting procedure. So you need to know some theory part regarding this. So all these surface irregularity are actually mostly seen on actually the surface area. And casting with phosphate bonded investment is more prone to such imperfection. This is another neat question. Which of the investment material is having most of a casting defect? That is like phosphate bonded investments. So normally the irregularities which are seen is like three important things: the nodules, water films, and fins. So talking about nodules, the nodules are of various type based on the size. One is like small nodules. Small nodules are because of the bubbles of gases that are trapped between the wax pattern and the investment procedure. Large module is actually the air trapped during investing. So never forget, the first is because of the air trapped between the wax pattern which we create and the investment procedure. The last module is like the air trapped during investing. So the occlusal surface nodules are mainly because of actually the prolonged vibration after pouring, which is responsible for the nodules on the occlusal surface. Another important cause for multiple nodules is like because of the inadequate vacuum during mixing, improper brushing technique, lack of wetting agents, etc. Right. So how to prevent the nodules is like properly doing a mixing under the vacuum, either by mechanical or actually manual methods, and using of a proper surfactants over that wax pattern before investing. So this is very important points that you need to keep in mind. So the question will be like, what are the methods to prevent a nodule formation? So you need to know the important points in order to actually eliminate the unwanted answers, right? So the question is like, multiple nodule in the inner surface of casting can be avoided by. So the answer is like selecting cool mold technique. So this is actually a method of actually avoiding the unwanted nodules that is actually present on the occlusal surface as well as on the proximal surfaces, right? Next question. The GIC color and clinical appearances is determined by. So there are various options being given. So the answer for this question is like the chemical composition. We know that GIC consists of silica, alumina, like fluoride, etc. So it is always depending on the chemical composition, like the alumina to silica composition and the reaction to polyethylenic acid. So what happens is like if the glass is very high, that is the silica is very high, and what happens is like it can give a transparent nature. While alumina is high, it give an opaque nature. So please keep in mind the GIC color and the clinical features is actually depending on the chemical composition based on the alumina to that of actually silica. Right. The next question. If what occur if gypsum is heated above 700 degrees centigrade? So what happens is like simply we sulfate which actually affect the gold alloy taking place. Next question. Pick the wrong statement in relation to the dispersion strengthening. So before answering this question, it is very important to know what is dispersion strengthening. So we know that the ceramic is often brittle and they are having low fracture toughness and low tensile strength. So in order to increase the strength of ceramic, we do a procedure called as dispersion strengthening. Dispersion strengthening means we'll be adding like glass faces will be added, or we can actually why we do this is like to prevent the brittleness of the material, to actually increase the crack resistance and toughness of the material, etc. has been actually increased in these cases. So first of all, so the answer is like pick the wrong statement in relation to the dispersion strengthening. The first is like mainly it should be wrong, mainly for glass-based ceramic. Yeah, we've been using this for actually the glass-based ceramic. Next is like dispersed particle size doesn't matter. That is wrong. Actually, dispersed or the size of the glass particles is very important for actually determining the strength of ceramic. So that is actually the wrong answer. It inhibit crack propagation. That is not wrong. That is a correct answer. They help in actually prevent propagation. Next is like variety of dispersed crystalline phase are used to strengthen the ceramic. Yeah, because there are a lot of phases of crystalline, dispersed phase that is used for actually strengthening the ceramic material. So see the last point, toughening depend upon the crystal type, its size, volume, fraction, etc. And they actually determine the thermal expansion of the material. Right. Next question, not about use of flux. So we know that flux is excessive flux. So we know that flux is a material that is actually used for joining the metals so that it will flow properly. So what is not true? So these are the questions that you will actually face when you answer the NEET MDS question paper. Because we have to know the proper answer, then only you can actually eliminate. So before answering this kind of question, you need to actually uh, repetitively read the like options and eliminate the like which is not relevant answers. So not true or used, not true about the use of excessive flux is like, what do you think? Porcelain discoloration. Bubbling in porcelain. So before answering this question again, I need to actually explain the theory part. It is of primary importance to minimize the amount of flux. Flux should be there, but it should not be excess. What happens is like when excess of flux is there, they get in between the filler particles of the metal and they can weaken the joint. That is one thing. Excessive flux can actually cause the discoloration of the tooth, discoloration of the material, and also they can actually bring about the bubbling in actually the porcelain too. Flux combined with the metal oxide and forms a glass during the soldering procedure, and the residue should be removed. Sandblasting of the joint immediately after removal from soldering investment with aluminium abrasive and boiling in water for 5 minutes are actually recommended. So why flux should be there, but it should be in actually a particular concentration. If it is more, it get incorporated with the filler forming a weakened joint and they can cause discoloration. They can cause actually bubbling of the porcelain. So how we actually remove the excess of the flux is by using a sandblasting material, and we'll be using abrasives for 5 minutes. So the option in this question is like removal of the excessive by boiling in hydrochloric acid. That is a wrong answer. Discoloration is actually seen. Bubbling of the porcelain is actually seen. And excessive removal by boil. No. We use a sandblasting process where we'll be using alumina. So it can actually weaken the joint. That is the answer for the question. Next question. The process in which a material melt to form a crystalline phase and a liquid phase is known as. So this is again a term which we are not much familiar, but still the ask question. So sometimes when we actually melt a material, it can form two phases. One will be actually liquid and there will be some crystal phase in that. So the answer for this question is incorrigate melting. So it is called as incorrigate melting. And this is actually commonly been seen in feldspar. So please keep in mind this question. Just mark up actually this answer and the exam. Sometimes the question will be like, which among the following is having a incorrigible melting process? So it is like feldspar. So it will be having two phases. That is, it will have a crystalline phase as well as actually a liquid phase will also be actually seen, right? Next question. What is Rauch? So Rauch, what is Rauch? We know that flux has been added for the flow. So in order to actually prevent the flux flow, we'll be using something called as anti-flux. So anti-flux is actually, which actually prevent the flow of the material. So Rauch is actually the common material that is actually used. It has been mixed with the chloroform and graphite, and we will be painting on the area before heating the substrate metal, right? So the question is like, Rauch is used for? We know it is to prevent the flow of the solder to unwanted area. Flux FF, it helps in flow. Rauch is actually a material that is anti-flowing material or anti-flux material, right? Next question. The maximum flow of inlay wax at 37 degrees Celsius is. You need to study as such, it is 1%. According to AD specification, it is like 1% is the maximum flow of inlay wax. Next question. Which of the following is added to prevent the polymerization of polymer during storage? So we know that when we actually store a resin matrix, there is chance of polymerization. So in order to actually prevent polymerization, we will be using a hydroquinone, which will prevent the normal unwanted polymerization when we store a material. Next question. If denture curing is done at a temperature above 100 degrees centigrade, then porosity is seen. So whenever we actually produce denture curing less than 100 degrees Celsius, so it will be actually producing porosity in the peripheral area. So whenever denture curing is done above 100 degree, it will cause the thin central area, right? Please keep in mind. So what happens is like during the polymerization cycle, acrylic resin probably would yield porosity in very thick area of the denture since the temperature of the resin exceeds the boiling point of the monomer, that is, keep in mind 100.8 degree centigrade. Next question. Monomer evaporate due to increase in boiling temperature during curing. What will happen? So whenever monomer evaporate, what do you think? There is porosity in thick area, discoloration, partially cured denture, porosity in thin area. So whenever monomer evaporate, it often actually produce porosity in actually the thick area. So think that whenever it is actually heated above 100 degrees centigrade, also it actually produce porosity in the thick area. And monomer evaporates the increase in boiling temperature. It is more than the boiling temperature also, porosity in thick area is being produced. Next question. Difference in coefficient of thermal expansion between teeth and restoration effects. So as I discussed in the early dental materials class, coefficient of thermal expansion is a very important topic. We need to know that because coefficient of materials which we coefficient of thermal expansion of the materials, restorative materials which we select should have the coefficient of thermal expansion similar to that of enamel and dentate. Otherwise, what happens is like when 1 degree centigrade of heat increase take place, the tooth will actually increase its size. If it is not similar, the restorative material will sit as such and producing space in between the restoration as well as the tooth, which can lead to coloration, deterioration of the restorative material, secondary caries, and even the crack formation can take place. So it does actually affect the marginal integrity because margin is being affected when there is actually dissimilarity in the coefficient of thermal expansion of two important material. Answer is like marginal integrity. So very thank you for listening to my class. In this discussion, we had some topics which we are not into a theory, knowledge, certain terms. Especially, I've discussed about ceramics, stainless steel materials, nitty materials, and based on corrosions and porosity materials, which was not discussed in the early class. In the early dental materials class, we had a discussion on the all the cements, the gold, like amalgam, the basic properties of dental materials, etc. So the second part actually covered all the remaining topics, including corrosion products, especially stainless steel, because a lot of question has been asked from the stainless steel portion. Even though the question is easy for its answering, we often get confused with the like interchanging terminologies. So again, please go through the class and make it thorough. Thank you. Any doubts, please revert back to the Eden2 team. Thank you. Have a nice day. Keep on repeating and practicing for your NEET MDS 2025.